Myself, Dr. Prasanna Mishri Kotkar, Professor of Radiology, MGM Medical College, Aurangabad. I will be speaking on ultrasound of knee. Basically, the ultrasound knee anatomy is the main important subject. Indications for a knee ultrasound are evaluation of muscles, tendons, ligaments, joints, various vascular pathologies, guidance for injection, whether the lesion is cystic, solid, that is Baker cyst, or some mass lesion is there, evaluation of peripheral nerves. All these are the indications for ultrasound of the knee. More important thing is selection of the equipment and the transducer. So one should be using high frequency linear ultrasound on a good resolution, high resolution ultrasound machine. Usually specifically 7 to 18 megahertz probe should be used. Sometimes you have to use color Doppler on that machine also. Basic imaging is evaluation of the ultrasound. Anterior has to be evaluated anteriorly, medially, laterally and posteriorly. The anterior part of the knee comprises of quadriceps muscles, that is quadriceps vastus medialis, vastus lateralis, vastus intermedius, rectus femoris. They all combine together to form the quadriceps tendon, which gets inserted over the upper margin of the patella. Then one has to look for the suprapatellar races, suprapatellar fat pads, patellar tendon. The infrapatellar tendon has to be seen, which is inserting up to the tibial tuberosity, and underneath the tendon you will have to look for the Hoffa's pad of fat. Some bursas are seen there. Smaller one is infrapatellar bursa, which is just behind the insertion of the suprapatellar patellar tendon. Just proximal to it, there will be deeper infrapatellar bursa. There will be smaller, very thin prepatellar bursa, which may not be seen. Only if there is a effusion or inflammation and fluid collection is there, then that bursa will be seen. Stop. Then medially, the medial meniscus and medial longitudinal ligament. Laterally, the lateral meniscus and lateral collateral ligament are to be seen. Posteriorly, the knee has to evaluate for popliteal vessels, any bursal evaluation, meniscus and any ligamental injury and neurovascular bundle. Then in a transverse section, flexed knee, one has to look for the trochlea, where you can able to see the trochlear cartilage. Any irregularity or any excess amount of fluid will be seen and should be diagnosed as inflammation or injury. Then coming to lateral knee, when a patient has to turn his position, and the lateral part of the knee should be anterior facing the doctor, and then you have to evaluate transverse and longitudinally. One has to look for the lateral longitudinal ligament, collateral ligament, lateral meniscus, any amount of fluid. One has to evaluate the iliofibular band, which is extending from the hip joint, and a thin linear band will be seen, which is inserting up to the on the upper margin of the fibula. Then pes anserine, that is combination of gracialis, semimembranous and sartorius muscle that get inserted on the medial aspect of the tibia posteriorly. Then one has to look for the biceps femoris and popliteus muscles. And important things are like vessels, popliteal vessels, they are crossing each other, and adjacent to that will be popliteal nerve, which will be seen in continuation of the sciatic nerve, which divides into posterior tibial as well as superficial femoral, peroneal or fibular nerve. The muscles which will be seen in posterior aspect and transverse from medial to lateral are sartorius, gracialis, semitendinosus. Between the semimembranous and gastrocnemius, there will be bursa, which is called as Baker cyst. This completes the evaluation of the knee ultrasound, anterior, medial, lateral and posterior aspect. So the anatomy will be depicted very well on ultrasound. It will, because of its dynamicity, one can see actual action over the MRI evaluation. Ultrasound has many advantages over other modalities, especially MRI, since it is a dynamic study, no radiation, so no ionizing radiation, so less chances of carcinogenesis. Ultrasound being easily available has become less expensive as compared to the CT and MRI evaluation. There is no requirement for the contrast injection. That again helps. Another important advantage is one can always repeat at very less cost, and comparison of the contralateral part is easily available and is less expensive. But there are disadvantages also. This important disadvantage is it is operator dependent. So one has to have a proper training, then only interpretation is possible. It is not good for evaluation of internal structures like cruciate ligament injuries. Another disadvantage is ultrasound cannot differentiate between air, gas, or any injury. Important pathologies that can be diagnosed on ultrasound are loose bodies, cystic lesions, bursitis, injury to the ligament, injury to the muscle, musculotendinous junction, bursal infections, bony injury, bony infections, vascular injuries, and important is nerve injuries, which are very well seen on ultrasound over other modalities. So what are the important indications for evaluation of ultrasound of knee? That is, one of the commonest is pain, any swelling, any injury, any suspected injury to the ligament or muscle, inflammation of the bursa,